Good morning, everyone. Am I audible? Good morning, everyone. Okay. Good morning. We are starting with our lecture. Today's topic is adverse drug reactions. Up till now, we have discussed about pharmacodynamics. We have learned about various definitions, then receptor and non-receptor mediated mechanisms, how the drugs are acting in our body, how it is producing the effect, both at the, you can say at the gross level and at the cellular level. Then we have discussed how to measure the drug effects, especially the dose response curve that we have studied, including the quantile dose response curve and graded dose response curve. See, most of the drugs are having their effects. That is why they are there. Most of the time, it is for therapeutic use. But remember, it is also producing some kind of the effects that we do not want. So in today's topic, we'll learn adverse drug reactions. So everyone is having questions whether this particular effect that a drug is producing that is not wanted, whether it is a part of the disease, it is the new symptom that is related to disease, or that the medication is producing. So there is no drug with a single effect. So always there is a drug that is having adverse effect. है ना, कोई safe तो नहीं है. Only thing we want is maximum therapeutic effect of that particular drug for that particular disease or symptom and with minimal adverse effect. So today we'll learn some principles of pharmacovigilance and ADR reporting system. Also, we'll define it and some details we'll learn today. So what is ADR? Adverse drug reactions, according to WHO. It is any response to a drug which is noxious and unintended. Remember, it is a noxious one and unintended, and which occur at doses normally used in men, in human beings. So it is in the therapeutic range, but still we are having some effect that we do not want. So we are using the drugs either for prophylaxis, whether it is to be for diagnosis or for the therapeutic purpose, or for modification of the physiological functions. है ना, नॉर्मल पर्सन भी लेते हैं, है ना, ओरल कॉन्ट्रासेप्टिव पिल जो है वो नॉर्मल पर्सन, ह्यूमन वाले नॉर्मल पर्सन है वो ले रहा है. Okay, so it is a noxious and unintended response, usually occur at the doses that we are using, that is the drug we are using for the doses that is in the therapeutic range. For the simplicity, there are so many classifications, one has to take any one. So I have taken type A, B, C, D, E and F. That is easy to remember and easy to describe. Remember, these are the adverse effects. The effects produced by the drug in our body that we do not want. But still they are there. So we are having type A, type B, type C, type D, type E, and type F. Predictable, type A, that is expected. Most common, predictable and expected, that is type A. Unpredictable, unexpected, हमको पता नहीं है कि कब होगा, ये टाइप बी. Type A, predictable, expected, that is in the form of side effects, secondary effects, and the toxicity. We'll learn in detail in subsequent slides. Unpredictable, also unexpected, that is type B, in the form of hypersensitivity or allergic reactions, genetically determined, and idiosyncratic reactions. They are all, these three falls in type B. We are also having C, D, E, and F. A means, remember, augmented. B for bizarre. C, continued use of drug, continuous use of drug, prolonged use of drugs over months. D for delayed. Delayed means over years. E means end of use. If somebody is stopping to take that particular drug, then there may be some withdrawal symptoms, that is end of use. And F, that is later on added one, is the failure of therapy. Most of the time, you can say that is happening with the antimicrobial agents due to antimicrobial resistance, failure of therapy. Maybe so many reasons. So let us take one by one with examples. Type A, augmented. As earlier we have discussed, they are predictable one. हमको पता है ये होगा. And it is dose dependent. थोड़ा बहुत dose बढ़ता जाएगा, though in the therapeutic range, effects may get increased. Incidence rates are high, but mortality low. And these all are based on pharmacological properties of drugs. They are preventable and they are reversible by reduction in the dose. We can prevent by taking precautions, by monitoring the patients, and by asking the patients whether if somebody is having some adverse effects, some kind of newer symptoms or not, like that. And augmented reactions, we can classify in side effects in the form of side effects, secondary effects, and toxic effects, right? So let us take in detail. Side effects. Augmented. That is within the therapeutic range, we are expecting it may happen. Side effects may be the same action like the therapeutic effect that is produced by the drug. Or it may be different than the therapeutic action, or it may be same as therapeutic and adverse effect. Let us take example. Side effects means it is a part of the pharmacological actions of the drug. Remember, हमको जो इफेक्ट चाहिए वो थेरापेटिक यूज होगा, हमको जो नहीं चाहिए वो एडवर्स इफेक्ट होगा, right? For that particular disease, that particular symptom or illness, for that particular patient. Example, GTN. I have written this short form, glyceryl trinitrate. It is where we are using to relieve anginal pain. Acute attack of angina, we are giving glyceryl trinitrate, or you can say nitroglycerin. Anginal pain, angina क्या होता है? There is ischemia, less blood supply to the heart. Glyceryl trinitrate will do dilatation of the blood vessel, especially in the coronaries and also in the other vessels. So it is producing dilatation of blood vessels. It is its effect, pharmacological effect. So it relieves the anginal pain, that is the therapeutic use. But because of dilatation, there is postural hypotension, there is throbbing headache because of vascular cerebral blood vessels जो dilate होती है उसके लिए throbbing headache होगा, that is adverse effect. It may be different than the therapeutic action. Classical example is promethazine. Promethazine is antagonist at the histamine receptors, histamine type 1 receptor. Histamine is responsible for allergy. So we are blocking these effects. So its therapeutic use is anti-allergic action. So for allergy, we are using promethazine. But it is also crossing the blood-brain barrier and also responsible for blocking the H1 receptor in the brain. So it is producing sedation. So it is an adverse effect. But anti-allergy action जो आ रहा है वो therapeutic use होगा, है ना? But sedation produce हुआ, sometimes we do not want. That is sedation. है ना? जो कंपनी में वर्क कर रहे हैं, मतलब मैकेनिक, so that we do not want. That is an adverse effect. Codeine is one of the drug that is having constipation. It is reducing the peristaltic movement and responsible for constipation. Codeine has 3 therapeutic uses mainly. One is analgesia, pain relief karega. Second is cough suppressant. And third is by having constipation, we are using it in traveler's diarrhea because it reduces the peristaltic movement. Though this is the good for traveler's diarrhea, this is good. Constipation, because it reduces peristaltic movement. But for pain relief, we are giving codeine and producing constipation that we do not want. Okay. So these are side effects, extension of pharmacological actions. In the same type A augmented, we are also having secondary effects. Sorry. Secondary effects. Basically, they are indirect consequences of primary action. Let us take example. One is tetracyclines. Tetracyclines are the group of drugs where tetracycline, doxycycline, minocycline, doxycycline, they are there. Tetracyclines, they are broad spectrum antimicrobial agents. This we are using as an antibiotic. But what is happening in our body? We are also having common cell. We are having bacterial flora in our colons, in our GI tract. Tetracyclines are broad spectrum antimicrobial agents, though they are known to suppress the bacterial flora also. These are the good bacteria that is helping for the digestion of the food. But because there is suppression of bacterial flora in the GI tract, there may be chances of superinfection. Infection, especially with the fungi. We may have a fungal infection on prolonged use of tetracycline. This is actually the secondary effects, not directly related to primary action, but indirectly related to primary action. Second example I have given is corticosteroids. Steroids, well known, corticosteroids, prednisolone, betamethasone, dexamethasone, betamethasone. Corticosteroids we are giving for immunosuppression, immunosuppressive effect. So it weakens the host defense. क्योंकि immunosuppression action हमको चाहिए, है ना? Supposing the, I'm sorry for repeated cough, though I am COVID positive, I'm taking your lecture, so bear with me. इम्यूनोसप्रेशन कहाँ देंगे हम? इम्यूनोसप्रेसिव इफेक्ट कहाँ पे हमको चाहिए? इन वेरियस कैंसर कीमोथेरेपी. As an adjuvant, we are using corticosteroid also to prevent graft rejection. So We want immunosuppressive effect of corticosteroid, but at the same time, it is also weakens the host defense. So there are more chances of bacterial, other bacterial and fungal infections that we do not, है ना, हो सकता है, ये होता है, right? So these are secondary effects. They are indirect consequences of primary action. This is secondary effects. Toxic effects. हम यहाँ पे ऐसे बोलेंगे excessive use of drug. Higher dose. ऐसा तो नहीं है कि मैं 500 मिलीग्राम पैरासिटामोल लूंगी, मुझे एडवर्स इफेक्ट आ सकता है, जबकि कोई 650 लेता है तो नहीं है, though they are in the therapeutic range. Sometimes it may be due to overdose, but most of the time prolonged use, not too much prolonged use, but augmented. We are knowing these are the excessive pharmacological action. Classical example, gentamicin. Gentamicin is an antibiotic, aminoglycoside group of drug. It is mainly excreted, वो पढ़ा ना pharmacokinetic में, mainly excreted by the kidney. They are not get absorbed. We are giving by parenteral route. This is one of the antibiotic act on the gram-negative organisms, but it is responsible for nephrotoxicity on prolonged use. Atropine, anticholinergic drug, ना acetylcholine को block कर देगा at muscarinic receptors. It is responsible for hallucinations. Paracetamol, PCM बोलते हैं ना, paracetamol. This on prolonged use or excessive use leads to hepatic necrosis. Sulfonamide. Sulfonamide, they are antibiotics, highly concentrated in the urine and responsible for crystalluria. Crystal formation होता है. Digoxin, we are using for heart failure, responsible for complete AV block. Arrhythmia उसके adverse effects है, but it may lead to AV block. So these are augmented excessive pharmacological actions. These are type A, augmented adverse effects. Type B, they are bizarre, usually unpredictable and non-dose dependent. चाहे थोड़ा भी डोज दो, चाहे मिनिमम डोज क्यों ना दो, it is able to produce some reaction, not in all persons. Usually uncommon and with high mortality if not getting treated immediately. Nowadays we are having so much technology and so many detections. We are vigilant now, so we can able to deduce. The purpose of having this lecture is to understand the adverse drug reactions and also to prevent it as far as possible. And you should be vigilant. These are our main purpose. So they are uncommon and with high mortality. Mechanism is unrelated to pharmacological effects. Remember, type A में जो था कि डोज कम किया तो कम हो जाएगा ADR, यहाँ पे नहीं होता है. Reduction in the dose does not reduce it, and that may determine ADR and idiosyncrasy. So they are unpredictable, right? आज पेनिसिलिन लिया, उसका एडवर्स इफेक्ट नहीं आया, लेकिन बाद में कभी लिया है ना, 1 महीने बाद या कभी भी पेनिसिलिन लिया और रिएक्शन आ सकता है. जरूरी नहीं है कि आपने वही थेरापेटिक डोज लिया या ज्यादा डोज लिया या कम डोज लिया. This is bizarre. That is in the form of drug allergy, immunologically mediated stereotype symptoms. So one drug is capable of producing different types of allergic reactions in different persons and of different duration. Right? It may be IgE mediated, it may be cytotoxic, it may be immune complex mediated, and it may be delayed one, cell mediated one. But these are bizarre immunologically mediated stereotype symptoms. We are not going in detail today. Genetically determined, we have discussed the example of succinylcholine apnea last time. Because of atypical pseudocholinesterase there in the plasma. A mechanical ventilation, because of the सक्सिनाइलकोलिन का इफेक्ट नहीं जाएगा, वो रिलैक्सेशन में रहेगा मस्कुलेटल मसल्स, सो रेस्पिरेटरी पैरालिसिस ही रहेगा, वो रिकवर नहीं कर पाएगा आफ्टर एनेस्थेसिया, आफ्टर टेकिंग ऑफ सक्सिनाइलकोलिन, बिकॉज ऑफ presence of atypical pseudocholinesterase enzyme, genetically determined. We have also discussed the hydroxylase polymorphism with the isoniazide that we are using for tuberculosis, that is responsible for peripheral neuritis or hepatotoxicity, right? Idiosyncrasy. Again, here we do not know the mechanism. Halothane induced malignant hyperpyrexia or chloramphenicol induced aplastic anemia. Idiosyncratic reaction. We do not know what is still the mechanism. We cannot, till now we are not understanding this, how it is producing. So these are type B, bizarre, though uncommon, responsible, may be responsible for death, may be responsible for morbidity. Type C. Type C on chronic use. C means chronic. On chronic use of analgesics, antipyretic agents, non-steroidal anti-inflammatory drugs. See, in our most of the world, we are having osteoarthritis. Not only osteoarthritis, but people are suffering from various arthritis like rheumatoid arthritis, gout. And for that purpose, we are giving analgesic like ibuprofen or diclofenac. है ना, वो वेरान देते हैं diclofenac. So on chronic use, it is responsible for analgesic nephropathy because it is mainly they get excreted in the kidney. So ये ऐसा जरूरी नहीं है ये नेफ्रोपैथी करेगा. Paracetamol hepatotoxicity करेगा. There may be dyskinesia with the levodopa that we are using for Parkinsonism. So on chronic use, ना over months अगर कोई use करता है और उससे जो effect आता है, that is chronic one, type C. Type D. Yes, by having a vigilance on the patient. है ना, फॉलो अप बोलना है, पेशेंट को बोलना है कि कुछ एडवर्स इफेक्ट आए तो हमको बताओ, एंड बाय डूइंग सर्टेन टेस्ट. टाइप डी is the delayed one. Classical example is carcinogenesis and teratogenesis. See, on prolonged use of hormonal contraceptives, estrogen खास करके responsible for carcinoma, vaginal carcinoma, क्योंकि वो हाइपर प्रोलिफरेशन करता है एस्ट्रोजन. जरूरी नहीं है कोई 4-5 साल तक यूज करता है, जरूरी नहीं है कि उसको हो, किसी को हो सकता है, बट दे आर एबल टू प्रोड्यूस कार्सिनोजेनेसिस दैट इज डिलेड over years. Teratogenesis, we are coming to that later on. Harmful effect to the fetus, delayed one. इमीडिएट आता नहीं है, इमीडिएट आता है तो एबॉर्शन हो जाता है, लेकिन टेरेटोजेनेसिस that also you need to be very watchful. Phenytoin, अगर प्रेग्नेंट वुमेन ने लिया तो she is suffering from epilepsy, fit phenytoin चालू है, आपको पता नहीं है पेशेंट प्रेग्नेंट है, पेशेंट में have or fetal may have a fetal hydantoin syndrome. क्लेफ्ट पैलेट भी हो सकता है, फॉलिक एसिड डेफिशिएंसी होता है, डिलेड इफेक्ट हमको तुरंत देखने नहीं मिलेगा. टाइप ई, एंड ऑफ डोज रिस्पॉन्स. एंड ऑफ डोज रिस्पॉन्स, पेशेंट बहुत लंबे टाइम से ड्रग ले रहा है ना, लाइक फेनिटोइन एपिलेप्सी के लिए ले रहा है, सडनली स्टॉप किया तो क्या होता है? रिमेंबर दैट अप रेगुलेशन, डाउन रेगुलेशन ऑफ रिसेप्टर्स होता है ना कहीं कहीं पे. बट व्हाट इज हैपनिंग हियर विद द फेनिटोइन, देयर मे बी विथड्रॉल सीजर्स, दैट पर्टिकुलर डिसीज मे गेट प्रेसिपिटेटेड. सो एंड ऑफ डोज रिस्पॉन्स, डोज उसने बंद कर दिया, पेशेंट ने दवाई लेना बंद कर दिया, स्टॉप कर दिया, तो उसको विथड्रॉल सीजर्स भी ज्यादा देर से आ सकते हैं, राइट. और देयर मे बी रिबाउंड हाइपरटेंशन विथ प्रोप्रेनोलॉल. Propranolol is the beta adrenergic blocker, beta 1, beta 2 receptor blocker, non-selective beta blocker. It may be used in the hypertension. We are not using though nowadays. We are using cardio-selective, that is beta 1 selective blocker. But if it is used for prolonged purpose, then it may be responsible for rebound hypertension. This is end of dose response. मॉर्फिन भी लिया जाता है ना. मॉर्फिन एडिक्टेड पर्सन को क्या होता है, वही तो बहुत लंबे टाइम तक लिया, उसका यूफोरिया इतना नहीं आया तो उसको लेना बंद कर दिया, तो विथड्रॉल सिम्टम्स आते हैं. सो मोस्ट ऑफ इट इज हैपनिंग विद द अब्यूज पोटेंशियल ड्रग्स. टाइप एफ, एफ फॉर फेलियर ऑफ थेरेपी, that is antimicrobial resistance होता है. तो though you are giving the drug in the therapeutic concentration, therapeutic dose range में ही आपने दवाई दी, फिर भी उसका रिस्पॉन्स नहीं आता है, okay, that is failure of therapy. So type F. So these are the 6 types, A, B, C, D, E, and F. Though ADRs are classified in different ways, these are the most easy to remember and easy to describe. Detail also you will learn during your practical classes. These are some peak allergic reactions, over the skin, over the lip. edema होता है, lip edema, analgesic, nephropathy affecting the kidney, photosensitivity, खास करके tetracycline group of drugs जो कोई लेता है तो अगर धूप में जाएगा तो इसमें हैपन. So what are the clinical implications? It is necessary to recognize the ADR. If possible, we can prevent it. Easy to manage. If we know that, we can reduce the dose or we can withhold that particular drug from the therapy. We see it may affect the concomitant therapy. So यहाँ पे भी हम कुछ watch रख सकते हैं, है ना. And if we know this particular drug is causing particular ADR, so we can able to treat that symptoms. Remember, Anyone can describe this thalidomide disaster? किसी को याद है या पता है कुछ? What was happened in 1961? Yes. Someone close, morning sickness. Yes. तो क्या हुआ था? Imani? Causes side effects in the newborn. What type of effect you can see here? Shortening of limbs, seal limbs. Seal के होते हैं, ऐसे होता है ना limbs, seal limb, shortening of limbs. So very good. Where it was happen? So you are very close. Thank you. It was happened in 1950s, 60s. ये ऐसे पता चला कि some of the children are having that seal limb, shortening of limb, है ना, फोकोमेलिया. तो उससे back calculation and back study किया गया. Those women who are having their children with seal limb, short limbs, they have get studied. It was found that those women who had taken thalidomide, at that time thalidomide was a very common drug for morning sickness, for vomiting and also producing sedation. Those women who had taken the thalidomide, not all, but most of them, there was a causal relation to have that short limb. Those women who had taken thalidomide, most of them have found the children with seal limb. And from that time onwards, the reporting of ADR was must. Right? So there was a thalidomide disaster और इसी से याद रखा जाता है कि जो ADR monitoring को start किया उस टाइम से. Right? So what is ADR monitoring? It is the process by which data on ADR are collected, compiled and analyzed with the aim of optimizing drug therapy. Also, pharmacovigilance. Pharmacovigilance is the science and activities related to the detection, assessment, understanding and prevention of adverse drug effect, or you can say any other drug related problems. You can see so many therapeutic uses, adverse effects in the books for that particular drug. हमको कैसे पता चला कि ये ड्रग से ये ADR आता है? Because of the studies, है ना, that the जहां पे पहले किया गया studies. So it is better to have this data. Indian data is very less. हमको नहीं पता है कि हमारे में ये disease होता है या नहीं, right? ये particular adverse effects होती है या नहीं. ADR, why there is a problem? ये problem है because it accounts for the hospital admissions बढ़ाता है. It may be responsible for death. It may complicate the drug therapy. It may decrease the compliance and may delay the cure. अगर हमको एक पर्टिकुलर ड्रग से ADR हुआ तो हम वो ड्रग नहीं लेंगे, दोबारा लेना नहीं चाहेंगे, राइट? क्लोरोक्विन से हमको बैड टेस्ट आता है तो हम नहीं लेंगे, हार्ट बर्न होता है हम लेना नहीं चाहेंगे उसको, राइट? सो if there is a problem, है ना, these are the problems, but most of the time they are preventable. Type A खास करके preventable है. They are obvious interactions, है ना? खास करके जो कंट्राइंडिकेटेड ड्रग्स है उसका यूज होना या नहीं ये भी इम्पोर्टेंट है ना, खास करके एप्रोप्रिएट इंडिकेशंस हो, मेडिकली अगर वो ड्रग उसमें देना चाहिए, रैशनल यूज ऑफ ड्रग्स. सो ड्रग यूज इन एन इनएप्रोप्रिएट क्लिनिकल इंडिकेशंस और मेडिकली अननेसेसरी. हमको अपर रेस्पिरेटरी वायरल इन्फेक्शंस हुआ और हमने बहुत सारी एजिथ्रोमाइसिन ले ली, तो नेचुरली एजिथ्रोमाइसिन उसका यूज नहीं है. वायरल में कोई भी एंटीबायोटिक नहीं चलेगी, एंटीबैक्टीरियल नहीं चलेगी. वी आर टेकिंग इट. Okay, so if we stop using azithromycin in viral infection, then azithromycin से adverse effects आ भी सकता है. क्या main adverse effects आया उसका? Microbial resistance, right? And वो बहुत डेंजर है. आप दूसरी बार उसको कैसे यूज करोगे? हमारे पास एक अच्छी सी ड्रग थी, आपको पता है, वी आर हैविंग सो मेनी मॉलिक्यूल्स, थाउजेंड्स मॉलिक्यूल्स हम सर्च करते हैं, उसको स्टडी किया जाता है, उसमें से हार्डली 0.2% या 5.5% वो मार्केट में आती है ड्रग. ओके, सो इतना एजिथ्रोमाइसिन इतनी अच्छी ड्रग होने के बावजूद उसका रेजिस्टेंस आता है. रैम्पंट यूज है ना, rampant use of antimicrobials कर देगा. So we can avoid, है ना? Is it avoidable? Yes, we can avoid such use, irrational use, inappropriate use. So we are having pharmacovigilance program of India, Indian Pharmacopoeia Commission under the Ministry of Health and Family Welfare, Government of India started its movement for preventing adverse drug reactions, for monitoring adverse drug reactions under these objectives, that is to promote the quality of drugs and pharmaceutical through the standard setting in Indian Pharmacopoeia. Indian setup, providing Indian Pharmacopoeia reference substances to the stakeholders. Also promoting rational use of medicines by bringing out National Formulary of India and by ensuring the safety of medicines and medical devices. Remember, here pharmacovigilance, we are also having material-vigilance. Nowadays, we are having so many medical devices, right? So it is also important to observe, monitor that medical devices also. So to ensure safety of medicines and medical devices through Pharmacovigilance Program of India, PVPI in short. And we are having our National Coordination Center at IPC Ghaziabad. Also we are having Material-Vigilance Program of India. इसमें वैक्सीन्स भी आ जाएगा, ब्लड एंड ब्लड प्रोडक्ट्स भी आता है. And our college, Prongsai Medical College, is one of the peripheral center for monitoring adverse drug reactions. Okay. What you can do with this program? How you can collect ADR? What are the sources of ADR reports? देखो, एक तो पेशेंट खुद बोलेगा, इन पेशेंट है तो बाहर से पेशेंट को आपने अगर प्रिस्क्राइब किया है तो आपको बोलेगा, आपके फ्रेंड को हुआ है तो आप बोले, है ना. हु शुड रिपोर्ट? anyone can report. Remember, anyone can report adverse drug. यहाँ पे हम suspected adverse event बोलेंगे. Whether it is really adverse drug reaction, whether it is exactly related to drug, so उसको ADR बोलते हैं, related to adverse drug reaction. ये देखने का काम डॉक्टर का है, मतलब हमारा है, through causal analysis. Anyone can report, even patient can report. How to the ADR form, adverse event form. And what ADR should be reported? Any ADR report should be reported. Though mild, though severe, severe होता है तो 24 hours में report करने रहते हैं, right? This is the website. You can even visit that website, ipc.gov.in. Pharmacovigilance Program of India. You will find various forms here. Even it is there in Hindi, even these forms are there in Gujarati. So anyone can fill. What are the contents? This is one example, suspected adverse drug reaction form. That is managed by CDSCO, Central Drug Standard Control Organization. This suspected adverse drug reaction form includes 4 stated information. Second is suspected, the detail related to suspected adverse drug reactions. Also about the suspected medication, and 4th one is reporter's detail. Those who is reporting this adverse effect. Patient related information is important. Age of the patient, important है ना, even sex, weight of the person. We need to have a detail about the adverse reaction. कब आया reaction, कब stop हुआ, whether it is stopped or not, and ये reaction में क्या हुआ, all the detail, है ना, कब start हुआ, कैसे हुआ, like that. In the C, you can have suspected medications, including all medications that patient is taking. पेशेंट जरूरी नहीं है कि हमने प्रिस्क्राइब किया है वही दवाई ले, उसके साथ साथ दूसरी भी, मैंने बोला था ना आपको, हमारे पास बहुत सारी अल्टरनेटिव मेडिसिन है, पेशेंट ले भी रहा है तो ये भी डिटेल आप लिख सकते हो. इन द सस्पेक्टेड मेडिकेशंस, ऑल द डिटेल वन कैन राइट. हम सस्पेक्ट कर रहे हैं ना, वेदर इट इज ड्यू टू दिस पर्टिकुलर ड्रग और नॉट, दैट इज टू बी डिसाइडेड बाय हैविंग causality analysis. We are having so many scale detail you will learn during your practical classes. So it is there with your manual, pharmacology practical manual. Detail you will learn during your practical classes of ADR, pharmacovigilance. So all the details you need to write, name, whether it is brand name or generic name, manufacturer detail, batch number, expiry date, dose, रूट कौन से रूट से दिया हुआ है, कितने फ्रीक्वेंसी में दिया हुआ है, 3 times 4 times once in a day, सिंगल यूज दिया है ना, कब स्टार्ट किया थेरापी, कब एंड किया, है ना, कौन से रीजन के लिए यूज किया था, ऑल द डिटेल्स वन कैन यूज. ओके, अगर रिएक्शन स्टॉप हुआ है तो उसका भी डिटेल. एंड 4th वन इज रिपोर्टर डिटेल. This, whether it is patient or the doctor or the nursing staff or any healthcare professionals, anyone can report the details. This is important because who is reporting, that is important. Authentication, right? And for the future communication, right? So this is the form in English, and this is for voluntarily reporting of adverse drug reactions, right? Anyone can report. You can visit that site and you can have, right, all these forms. What information that we already discussed? For today's class, what you have learned? We have defined the ADR, we have discussed different types of ADR, how to prevent it, how to report these ADR, but still all further details you will learn in your practical classes. This is to provide the basic concept of the adverse drug reactions. Okay, and its monitoring. So I'm stopping here. Any question, any query? No questions? So thank you everyone. I'm stopping here.